The information provided in this podcast is for general knowledge and informational purposes only. It does not constitute medical advice. Always consult with a qualified healthcare professional for diagnosis and treatment of any medical condition. The views and opinions expressed by guests are their own and do not necessarily reflect the views of the Unplugged Healthcast or Dr. Wall.
Teach me about parasites, because I hear we all have them.
They're in your water, they're in your food. I would never eat salmon, ever, ever, ever. If you have little bumps on the back of your arms, you have parasites. If you have a lot of rashes, you have parasites. If you crave sugar, you have parasites. If you think you have parasites, or you have pets, or
You're
alive, you got them. You need to clean them 2 to 3 times a year.
Neck pain, backaches, headaches, fatigue, the list goes on, and you're likely on it. Tired of the broken system and big pharma? We offer logical solutions, teach you to think critically, and empower you to reclaim your health. Welcome to the Unplugged Healthcast with Dr. Kevin Wall.
Hey, welcome back to the Unplugged Healthcast. I'm your host, Dr. Wall. If you knew what we knew, you would do what we do. I've been in practice for over 35 years. I've had the opportunity to see personally and or supervise over 2.5 million patient visits. There's a lot of information and just general knowledge that comes when you have been in practice this long and have seen this many different conditions. And today I'm joined with one of our favorite hosts, which we brought back to the show again, Dr. Jenny Bush, who is the clinic director, owner for our AFC Desert Ridge location, and the founder of the FlowerChild Method.
Thank you. Thank you for having me.
Today we have a fun show with all the knowledge. Now, you've been in practice for 17 years, I think.
Correct.
So you're halfway there.
Yep.
I got you by 2. And with all that knowledge, I wouldn't say we've seen it all, but I think it's getting close. I think I've seen most all of it.
I feel like I've seen a lot.
Yeah.
Yeah.
Here's what we're doing today. This is fun. We're going to give you 30 different health conditions, and then we're going to give you 30 different health solutions for those conditions, and we're going to do this in 30 minutes. That's the challenge. Are you willing to take it with me?
Yes, we got this.
All right. So hang on to your shorts out there. We're going to go furious, and we're going to go fast. Dr. Jenny, you're first on the chopping block. I'm going to give you a health problem, and you tell us everything you can do to solve it in 60 seconds. Here you go. Anxiety, major issue going on today in society.
Oh, that's huge. First thing, if your anxiety's high, try to get out of the situation that you're in. Number 2, deep breathe. So breathing in through your nose, out through your mouth, trying to regulate your breath, which will help with everything. Number 3, a little bit of lavender. You can smell it in your right nostril. That'll help a lot. Number 4, I don't know if many know about it, but the people with high anxiety, when you startle and you're really nervous, it's called a startle reflex. It could be something you were born with. You can help integrate that, meaning bouncing on a ball or doing starfish jumps. You can look them up. That will really help relax your body and calm your nervous system.
What about a cold plunge?
Oh, cold plunge is good. That's intense, though. I think it raises my anxiety, but they say it drops it.
We'll let them off the hook. Okay, what do you got for me?
All right, Dr. Wall. Shoulder problems.
Man, shoulder problems are such an epidemic in society. I've seen so many of those, and unfortunately, most surgeries for shoulder problems are pretty ineffective. If you are thinking you have a shoulder problem and you are considering surgery, I would tell you don't do it. The major reason most people have shoulder problems is as simple as your posture. When your shoulders roll forward, as everybody is doing today in society, sitting at the desk over the computer, as that your rotator cuff, the socket in your shoulder rolls forward also. So everything you do by reaching back for your seatbelt, for tucking in your pants, for reaching behind your shoulders, everything you're doing is hurting that rotator cuff if you just fixed your shoulder posture. So sometimes the best thing you do is get in a corner and do push-ups where your shoulders get stretched backwards. That's my easiest, number one, quick fix.
Yeah, and also like wall walks, just getting your arms above your head is so amazing for the shoulder.
We never put our arms above our head, and you need to. That's where your shoulders are the strongest.
Yep, climbing, all of those things that we used to do back in the day with the shoulders.
All right. Your second one. You ready?
Got it.
Jaw pain, TMJ.
Oh, that's a good one. Well, most jaw pain comes from not breathing properly, so not closing your mouth like all the mouth breathers. So honestly, you could just do mouth tape in the evening or something and help teach yourself to breathe properly. Also, loosening up, massaging the muscles really helps. And making sure there's nothing going on with your dental work would be my biggest recommendations.
Hold on. What's jaw tape? What'd you say? Jaw tape?
Mouth tape.
Mouth tape.
Yeah.
How do they breathe?
You breathe through your nose.
Really? Does that fix snoring too, I heard?
Yeah. Because then they're closing their mouth and they're letting their jaw relax.
Where do you buy mouth tape?
Amazon.
All right, there you go.
Yep.
Amazon.
Yep.
Mouth tape. You learned something. I learned something. Okay, what do you got for me? What's my second one?
All right, constipation.
Here's just a fact. I have heard many patients tell me because they have been told by their doctor that going to the bathroom a couple times a week, no big deal. If you don't go every day, if you go every 3-4 days, that's fine. I'm telling you, that is not fine. If you ever watched a cow eating grass, they're going every hour almost. If you're not going to the bathroom at least once a day, and we're talking number 2, right? Or 2 to 3 times a day, you are constipated. Simple things as getting up in the morning and drinking a full glass of water with lemon, just getting your peristalsis going, exercise, classic and simple to get your digestive system moving. But of course, the simple one, everyone knows, fiber. You got to eat some fresh fruits and raw vegetables. Those are classic. And if you're constipated, I'm telling you, you got to get that stuff out of you. It's making you toxic.
That was excellent. Yep.
All right. Your next one, bladder incontinence. Ooh, this one's a tough one. No one wants to talk about, but it's happening.
Ooh, it happens to all the ladies, especially after having kids. The biggest thing for bladder incontinence that I find is really just pelvic floor exercises, and you can find so much online. Pilates is like the new hit thing, but just pelvic floor exercises where you're trying to engage your tummy, and that means like just tightening your tummy back towards your spine. Also, you can take your hands, and I hope you all can see this, you can take your hands right at your pubic bone and do a little lift if you know you're going to walk or do some exercises that you're worried about. And you just lift up before, and that'll help and give you a few minutes for bladder incontinence. But the biggest thing, pelvic floor exercises. Engage that pelvic floor. That'll help.
Gosh, I feel so bad that the gals deal with that because guys don't seem to have that as much. And I hear them, I'm in Pilates, they talk about bridging all the time for that same thing. Is that true?
Yep. Bridging, engaging the glutes, engages the pelvic floor. How about skin conditions? It's a little broad.
Man, skin conditions, that is broad. In fact, it's the largest organ in your body. I don't think you guys even realize your skin is an organ. I just did a podcast. You have to go back and look on it. We talk about sunscreen. Everything you put on your skin will be absorbed into your body. So if you probably wouldn't eat it, I wouldn't put it on your skin. I think the number one issue we're dealing with skin conditions in our society is, again, all the toxic creams, the lotions, the sunscreens, just the perfumes and everything you're putting on your skin. Your skin problem is an inside thing, not an outside thing. It's not coming from your allergens as much as probably your gut and your liver and the toxins that either you're absorbing or you're not eliminating. Back to constipation on that one. Yep. You find someone who's got constipation, I'll show you someone who's probably got skin problems.
Oh, 100%.
All right. Next, we got brain boost.
So boosting up the brain. That's the big one.
Okay. How do I do that?
So brain fog can be a sign of many, many different things. It could be obviously sleep or fatigue, not drinking enough water. But the thing I want to talk about on this minute is B vitamins and making sure your B levels are normal, and also watching for environmental allergies because that's big for brain fog. So obviously you can have them tested. You can make sure your B vitamins are at proper range. And peppermint, sniffing peppermint helps with brain fog throughout the day.
Essential oils, some of those are
all
good?
the essential oils, yeah. Dr. Wall, sinus issues.
Wow, this is such again, another epidemic. It seems like there's like a million of these epidemics because we're so sick today. But sinus issues, here's the one thing you have to know. Your sinus is a filter, and it's designed to be moist. And if you are taking any medications or you're dehydrated and your mucous membranes are not cleaning themselves, you will lead to sinus infections, and then you take more medications and more Mucinex, and now you start getting layer over layer over layer of dried mucus, dried crap that's coming in. Your mucus is supposed to help you filter things out. Sneezing, coughing, blowing your nose. Those are all normal things. Keep doing it, but stop the Mucinex, please. In fact, that's what leads to all these people getting this sinus scraping surgery. Have you seen that?
Yeah, it's pretty scary.
Oh, it's just so traumatic.
Yeah.
And it's because there's layers and layers of dried mucus that people have been doing by taking the Mucinex or being dehydrated. I got to get off my pedestal on this one, but dehydration, stop the medications, more fluid, maybe a what do they call that, neti pot?
Yeah.
That you can get, or the old humidifier where people used to get humidity into their nose to help their sinuses.
Yeah, if you're using a neti pot, make sure it's distilled water. That's really important. So it's very clean. And then for my family, we do colloidal silver, which is a product that you can do nasally and like put it in the nose, obviously. And you see great results, which help balance the bacteria and fungus in your nose.
I'm keeping you in the mental health category. Depression. It is different than anxiety. What do we do?
All right, depression. That's a big one. The biggest thing I would say is get outdoors, fresh air, ground your feet. That helps so much with depression. 2, I would say journaling, trying to journal about positive things, not the negative things. You know, if you go to your therapist, they want to talk about all the bad stuff. Well, let's just change the thought process and think about the positive things first and see if your body will change from there. Another really good essential oil, though, is lavender and white angelica. Excellent for depression. You put it behind your ears, helps you get out through the day. All right, Dr. Wall. Pickleball elbow.
Oh, so you're hitting right in my wheelhouse now. I love pickleball. I did a podcast. You got to watch it. Pickleball elbow. If you're getting soreness, tendonitis, they don't call it tennis elbow now. It's pickleball elbow. And it's an epidemic of a problem because so many people are playing pickleball elbow. I'll tell you one simple answer. If you got an elbow that keeps getting sore and what doesn't heal, it's because you got a neck problem. Your neck is causing your elbow. I'm telling you, it's like 90% of the time. You get your neck fixed and your elbow will heal in between your episodes. And take a break, by the way. You can't play twice a day, every body part will sooner or later probably break. But give your body a break and get your neck fixed. Follow that one with wrist pain, because elbow, you got wrist. That's a common one too.
Yeah, wrist pain, it's usually overuse injury. The biggest thing I find for wrist pain is working the pronator muscles. That's something that's missed. You'll go in and they're like, oh, carpal tunnel, we need to cut that nerve or wear a brace. Brace makes it worse.
Horrible surgery.
Yeah, horrible. Just loosening up the muscles throughout the forearm really help. Even having where you can put your hand in water, warm water helps, and then like rice just to loosen it up. And then movement. Fluid mobility through your wrists is really, really important.
Some people do scraping. Have you ever heard of that? I know you do it in the clinic a little bit sometimes, don't you? And that's where they kind of scrape the adhesions out of the forearm muscles. I actually just hang. I like to just get in the gym and hang both arms and see how long. If you can hang for a minute, you'd be shocked how hard that is. But it's really good to kind of decompress your wrists.
And for grip strength.
Which they found is relative to longevity in life.
Pain holding you back? AFC Physical Medicine and Chiropractic Centers of Phoenix have real solutions to get your life back. With 9 valley-wide locations, we offer integrated care including chiropractic, medical, and nutritional support. Our approach goes beyond prescriptions, combining therapies to help you thrive. Don't let pain define your story. Take the first step towards living life to its fullest. Call us now at 480-210-6103 or visit afcchiropractic.com to schedule your appointment.
You're up, Dr. Wall.
This
is a big one. Fatigue.
Oh, man. Okay, I'll tell you this one. Chances are most people are fatigued in America because you can't absorb your nutrients. I did, a podcast just on dieting here recently. There's a reason you're hungry. It's because you're actually missing nutrients. There's a reason you're fatigued. It's because you're just missing nutrients. Your body doesn't have enough to make it through the day, the activity, the pickleball, the work, the stress levels. Get digestive enzymes, probiotics, be active, get adjusted, everything to help your digestive system. Get off the Prilosec. If I find somebody who's on that Prilosec, I'll find someone who's always tired, fatigued. It just goes with it.
There's no absorption.
Because it's no absorption. Absorption is better than digestion.
Yep, for sure.
All right. Well, then follow that up with IBS, one after the other. Irritable bowel syndrome for you people who don't know what IBS means.
Oh, gosh, yeah. That's a tough one. A really, really good thing for IBS, though, castor oil on your tummy, which if you haven't heard of castor oil, it's like the new hot thing. It's what we used to use, and you put it across your tummy, you lay down, and it warms up and calms the body, decreases inflammation. Also for IBS, you can't be, don't be eating the spicy foods that bother you. Movement really helps. Most of the time with IBS, people want to just lay down and lay around. That'll make you worse. And then drinking a lot of water. That's big. All right, sleep issues.
You got to reduce the caffeine, and at least at the end of the day. And of course, get off the blue lights at the end of the day. Most people don't realize those computers, those phones, they're keeping you up for a couple hours. It takes you a while for your brain to slow down. But I'll give you the one no one does think about. Everyone kind of knows caffeine and the blue light issue, but most people don't realize that when your upper neck, the top vertebrae in your neck, when that thing shifts, when you have a problem in the top of your neck, you're going to often have headaches, jaw pain, and you can't sleep. It's cord pressure. That part of your spinal cord is the largest right at the base of your brainstem. So if your upper neck is wrong, off, shifted, subluxated, out of position, you will not sleep. I'm telling you, I have seen babies where I treated them after a birth injury. They go home and sleep for 3 days because they haven't slept since they were born. They got their neck jacked up from when they twisted their head, pulling the baby out. And all I had to do was fix that atlas, that top vertebrae one time, and it changed their life. But adults have it too, and they don't get it fixed.
Yeah, I think the number one activity for patient care is they want to sleep better.
Yeah.
And most of the time they have chronic neck pain, and they're always asking me what's the best pillow.
ADHD, ADD, attention to deficit issues. Give us a couple simple things we can do.
Simple things for that. It depends on the age, but the biggest thing is trying to stay focused in your environment. So decluttering your environment is really, really important. Even like just the space of you do this task here, you do this task here. A really, really important essential oil, I say lavender, but lavender, lemon, and peppermint are great to help just relax the body and keep you focused. So that's something you could do. Very, very easy. Anything you want to point on that, Dr. Wall?
Man, that one's a hard one. I love the thing that we talked about when you and I did a podcast on children who don't crawl, don't actually learn this crisscross, don't train their brain to fire in the crisscross patterns, and it's relative to ADHD. Let your kids crawl as long as possible, but if you get ADHD kids in sports and coordination activities, balance coordination, anything like that, it's going to help kids focus and train the brain to fire in the right patterns, because that's often they're just getting their nervous systems firing incorrectly. And
it's usually just backwards. It's switched. The left and right brain aren't developing at the right time together.
And crawling and sports that require running and throwing all together, those are great for kids.
Yeah, like monkey bars, swinging, anything like that. Dr. Wall, acid reflux.
Oh, man, it seems like we've hit this one a few times. I'm going to make this one quick and simple. Lemon in your water, probiotics, enzymes, and sauerkraut or any cultured foods help your indigestion. And get off the Prilosec. We just did a podcast on a gentleman after 6 years of Prilosec and indigestion. He got stage 4 esophageal cancer. And I'm saying this seems to be extreme, but I've seen other cases like this. You got to stop the medications for acid reflux and go to natural water, lemon, probiotics, enzymes, sauerkraut. Go.
Okay, I'll add in papaya chewables. So those are really, really good to help with acid reflux. They sort of replace like the Prilosec Tums if needed, if you're eating something you know might bother you.
You're getting all the really kind of hard ones. Memory.
Ooh, memory. I love that.
Who have memory issues or memory scenarios.
Memory would be don't stop moving. If you stop moving and become sedentary, your memory will go. So working out, walking, just getting up and moving your body every day, deep breathing exercises are huge. I would say another one for memory is like the stuff where like your grandparents used to have around the house, like chess or checkers, word searches, something that just keeps your brain wanting to find the little fine details and things are really important, and that helps with memory.
All right. Next one.
All right. Headaches.
2 things you got to remember. 2 to 3 headaches in a year, I'll take it. That could be normal. Beyond that, you're not having normal headaches. I've heard that too many times. Once a week, once a month, those are not normal. There's something wrong. And often it's just your neck. I'm telling you, headaches come from your neck. Depending on where the headache is at will be determined on where your neck problem is. Lower neck problems give back of the head headaches. Upper neck problems give front of the head headaches. Look at where your headache's at and find a great chiropractor. I'm telling you, I had a 95% success ratio in fixing headaches. I bet you see a similar ratio.
Definitely. So right side, very common to be a digestion point. Yep. So and most commonly gallbladder. Left on the left temporal side is hormonal. Especially for women, you'll
So if
see.
they're getting real focused type of headaches, is
Yep.
that how they diachnose this?
Yeah, I mean, it's just like more tension headaches, right?
Okay.
But they're more on one side versus the
They're
other.
not the ice pick ones as much. It's
No,
just
the
that
ice pick-
throbby, achy thing.
Yep, ice pick ones are scary. Those
Yeah.
are the ones you pay a lot of attention to. Those are aneurysm-like. And then front right here in those sinuses, those are usually sinus and allergy headaches.
Yeah. And I still would look to the upper neck on that one for sure. But again, both. Fix
Yep.
your sinuses, fix your neck.
Yep.
Menstrual cramps. I'm glad I'm not answering this one.
Menstrual cramps. Alrighty. So there's an awesome oil. It is by Young Living, Dragon Time. It's mostly licorice. So licorice root. I think that's why we used to eat that a lot.
Yeah.
Licorice is really good at calming menstrual cramps. And now you don't, all the licorice is fake. So it's not really licorice. So castor oil, once again, across through there. And then Epsom salt baths. That'd be the biggest thing for a menstrual cramp.
What about magnesium?
Oh, magnesium's good for all cramps. So it does help.
Yeah.
For sure.
Okay.
Colic.
Colic. Well, first off, you got to know colic is not a disease. It is your baby saying, I'm in pain. Okay. The answer is not driving them around in the car for 8 hours or vibrating seats on your washing machines. The answer is there's something causing the baby to not feel comfortable. And I can tell you, I've seen it. It's usually some birth trauma. That the average pounds per square inch in a typical American delivery, where they actually grab and turn and twist the baby through the canal, is 50 pounds. And when you add 50 pounds to a baby's head to rotate their neck, to pull them out of the canal, they shift their neck, and it needs to be fixed by a chiropractor. I've fixed hundreds and hundreds, and I know you fixed more than I have in half the time that you've been in practice. It's just a massive issue, but it's fixable, isn't it?
Yeah, you just want to do it as soon as possible.
Yeah, get those babies checked early.
Yeah, or very early.
Yeah.
Yep.
People don't think it's something
And it's
that,
like miracle.
It's
miracle
stuff.
changes. Yep.
After an injury, it can feel like life's on hold, but at AFC, we're here to help you get back to what matters. With personalized injury plans and our expert staff, we don't just treat the pain, we guide you back to strength and confidence. Because getting back isn't just about healing, it's about thriving. Call us or visit our website to start your journey today.
All right, what about insect bites?
All right. Insect bites. There's a few essential oils that I always take with me. So the biggest one, orange oil and lemon. Those are great for insect bites and the swelling. You can also use, it's called a bentonite clay, and you can get it Whole Foods Sprouts. And say you get a spider bite, the ones that are like super swollen and like pussy, you put it on there and it'll pull out the venom.
Wow.
Yeah.
Cool.
Yep. Adrenal fatigue.
Yeah, nobody knows about this. No one knows they have it, and most of you have it. And it really comes, your adrenal gland is the gland that produces adrenaline. If you're under stress, everybody raise their hand if they're under stress. I think I see everybody's doing that. And that is wearing out your adrenal glands. And so if you don't do something to support your adrenal glands or help them recover, and some of the simplest things you can do is reduce your carbohydrate intake. And there's simple adrenal support. Ashwagandha is one that I know really helps adrenal recovery. And most people, especially gals, if their adrenal glands are off, their whole cycle's off, and there's issues relative to even getting pregnant.
Yeah. And then for the ashwagandha, taking it at night, you see better results because that's when your adrenals really heal. And then getting T9 adjusted. I see great results with T9.
Did that so many times.
Yep.
That lower thoracic vertebrae. All right, gosh, we're coming down to the end. This is so much fun. We're going to have to quit here soon. But what about sleep issues?
So more than anything for sleep issues, I would say insomnia. So I'll talk about insomnia. That would be where you just can't fall asleep. You can't relax your brain. And chamomile tea is huge for that and helping. Also getting out and grounding before bed. So just getting your feet out in the grass or just out, it just helps calm yourself. And then turning your Wi-Fi off at night. That is a really, really big one. Heart palpitations and computer neck syndrome.
To me, they're the same thing because a lot of people are getting these heart palpitations. And I'm not saying it's not your heart and you shouldn't get it checked, but I can tell you most of the time, your upper back, because you're humped over the computer and that top two vertebrae in your neck go straight into some of the muscles in your chest. and even innervate the heart itself. So when you get that upper part of your neck off, you will notice, and it feels like you're having heart problems or heart pains. And most of the time, it's actually your chest and or the nerves in your upper back. Get your upper back and your upper neck checked, and fix your anterior head posture. Move your computers up and get your posture fixed. Get your head back. Everybody's got anterior head posture. It's horrible. We have to fix this. We see this every day in epidemic proportions today compared to even 30 years ago.
Yep.
Parasites. Teach me about parasites, because I hear we all have them.
In a minute. Okay. Yes, we all have them. They're in your water. They're in your food. I would never eat salmon, ever, any salmon in a day. If you have little bumps on the back of your arms, you have parasites. If you have a lot of rashes, you have parasites. If you crave sugar, you have parasites. And I'm not just saying all big worms that we're scared of, but there is a company called Parify, and she seems to have like the best products right now out there that are super affordable. Parafy. And she has a great blog about parasites too. But if you think you have parasites or you have pets or
You're alive,
you got them. You need to clean them 2 to 3 times a year. 2 to 3 times a year.
It's gross to think about, but it's true. I'm afraid it's true. All right, what do we got? What's next?
Okay, after parasites, we got knee pain.
Knee pain. Okay, top 3 things you can do. First off, if you have knee problems, chances are your kneecap is not tracking correctly. And that's usually because either the medialis muscle, the muscle on the inside of your leg, is weak, or the IT band on the outside of your leg is tight. If the IT band is tight or the medial quadricep muscle is weak, it's going to pull your kneecap off center and make your knee unstable, inflamed, and your ligaments very prone to be strained or stretched or tore. So stretch your IT band out and strengthen the inner part of your quad. The way you do that is walking backwards on a treadmill. Isn't that true?
That is correct. I have one in the office.
I know, I heard. Yeah, it's great.
Mm-hmm.
So come check us out at AFC Desert Ridge if you got knee pain.
That's right.
Restless leg syndrome, if we're talking knees.
Methylated magnesium is really, really good. You take it before bed. Usually you'll want to do 1 to 3 capsules, depending on how much your body can handle. And then if you're really tight, a little just compression massage on your calf helps a lot. And then you got to drink water. I mean, water. Yeah. All my patients with restless legs are dehydrated.
Yeah. And really, that's as simple sometimes that is. Sometimes I see they have a lower back problem that magnifies that, but that magnesium really seems to fix it. And it's got to be methylated. Can't just be magnesium off the counter. Doesn't absorb very well.
Nope.
All right, we're coming down to the last 2. Let's bring it home.
This is a big one. Aging.
Oh, see, that's nice you threw it at me, the old guy here. There's this new product out there called Methylene Blue. And if you do the research, you watch one of our last podcasts we did with Dr. Mark Sano, we talked about this. But that focuses on stimulating your mitochondria to produce ATP, which is your energy sources. And when your mitochondria are healthy and not aging, then you'll be healthy and not aging. And the way you do it on top of that is take Methylene Blue and sit in an infrared sauna or red light therapy for 20 minutes every single day. I'm telling you, you're going to see a difference within 2 weeks. Not only will you feel younger, but your mitochondria will be younger. And that's the best part about it. Anything else in your young age you want to throw at aging?
I mean, we know thinking positive thoughts, that's huge.
Age is
if you're
a number.
happy, yep. And then movement is really important.
Got to get moving.
Yep.
What is grounding and why do we do it?
So grounding is where you're getting a part of your body onto the ground naturally, right? So skin to the ground. And I'm not saying on pavement. I'm saying on grass or dirt. It's like true nature is what you're getting. You could do a grounding mat too. They have those now. But if you can't get out, if you live in New York or something like that. But what it does is it helps with your body to calm itself. And it helps with the electrons. If we were going to get really crazy, it balances the electrons in your body so you're more grounded and more neutralized with the world, which is nature.
So that has to be done on it can't be done on pavement, right? This has got to be dirt or grass. Is that what it is?
Yeah, you need to be on something that can just balance your electrons, which pavement won't do that.
Okay. All right. Real stuff.
Yeah. Water and sand. So like the ocean, the beach, you feel very grounded there.
100%. That's why everyone loves the beach.
Yep.
Well, there you go. You got a reason to go on vacation now for the summer coming up. Yeah. Well, if you didn't get something out of that podcast and you didn't listen or you disconnected, but I'm telling you, there's something there for everybody. That's why the Unplugged Healthcast exists. Unplugging from the chronic epidemic that has caused America to be so sick. So if you're getting anything out of this, would you please do us a favor? Go to our website, leave a comment, share this podcast. There's a lot of hope, and most people have lost hope. I'd say, Doc, if we'd brought this home, what would we tell people that just would encourage them to find hope again in their health?
Yeah, healthcare could be so complicated, but bring it back to the roots. You know, the small little things really make a big difference, and never give up because,
You never know.
You never know. Miracles happen every day.
All right. Well, this is Dr. Wall and
Dr. Jenny Bush.
We are signing off from the Unplugged Healthcast. Be healthy, be blessed, never give up, never give in. We'll see you again on the next episode of the Unplugged Healthcast. Take care.